Hello, everyone. It's Jason Wisniewski from JW Senior Insurance here, coming at you with another video. And today's topic is going to be how we choose a Medicare health plan for our clients and how you can choose one um, by yourself also. But we're really going to walk through our process of what we do here and how we help our clients choose the plan that's right for them. Um, so let's start off here by saying that we are an independent broker. And I feel that that is probably the best way that we can help our clients is we're not stuffing a square peg in a round hole, so to speak. So we're not going to be limiting ourselves to, maybe one or two insurance carriers and only a handful of plan options. We contract with multiple carriers with many plan options so that we're able to go to our clients with their needs and match that to the correct plan. So I'll show you a paper form of what we use here when we have meetings with our clients. We call it the Medicare Needs Assessment. So you take a look here. The first page, aside from the basic personal information, the contact info here, you're going to notice that you're going to see who are your doctors and what, if any, prescription drugs are you taking, because that's going to be important. And many times that's going to lead us down the path of where we need to go to find the best plan for you. Because many people want to be able to keep their own doctors and they want to have access to them. And they also want to make sure that the medications are on the plan's formulary or a list of covered drugs that we're considering. So we're going to do that first, and then we're going to look at any other types of benefits that you may need. So on the second page, we ask about if you have, specific dental concerns because, various plans may cover different dental procedures. So we need to know what you may want to get done so that we make sure it's going to be covered by the policy that you take. Um, what kind of vision benefits are you looking for? Do you need transportation, rides to medical appointments? Is that an issue for you? Do you like a large over-the-counter allowance on your plan? Maybe a gym membership with the fitness benefit is important. So there's many aspects, other things like hearing aids. And we also ask questions about, this is optional whether you guys want to answer them or not, but about income, because there are many programs that either through federal assistance or state assistance that you may be surprised that you might qualify for to get extra help from anything for lowering your prescription drug copays to even getting help with the Medicare Part B premium or copays. There's many things out there that you may qualify for. So don't be afraid to ask us to see if you might qualify. But aside from that, that's really how we're going to do this because there's no magic formula to this. There's no best plan, so to speak, because that's all subjective. What works great for one person, they may love a particular plan and it works excellent for them. It's got their doctors, the medications, and everything they need. But for another person, it may be totally the wrong plan for them because it doesn't work out with their particular situation. So, that's why we try to have as many options as possible for people. We understand that there are different budgets and different preferences and different healthcare needs out there. It's all going to be individual. You know, if you come into contact with a broker that says this is the best plan for everyone, run from that person because it's just not so. I mean, it's going to be on an individual basis. What may work for your wife may not necessarily work for the husband in some cases. So, um, definitely some things to consider. If you are in the New Jersey area, that is our home state. You can actually come and see us. If you're in Burlington County, we are staffing the Walgreens locations in Willingboro and Burlington. The Willingboro location on Route 130, we're there Mondays, Wednesdays, and Fridays from 10 a.m. to 5 p.m. Or you can drop in and see us in Burlington on Route 130 10 a.m. to 5 p.m. on Tuesdays and Thursdays. If you can't make it into Walgreens, give us a call, 609 496 8030. You could also check us out on the web, www.jwseniorinsurance.com, and there is a contact form on there. You can also send an email to jwseniorinsurance@gmail.com. I'll get that. And we are also licensed, I'll mention, in other states besides New Jersey. We have Pennsylvania, Georgia, Maryland, North Carolina, South Dakota, Wisconsin, Florida, Texas, Michigan, and Maine. So if you're in any one of those states and you need our assistance, feel free to give us a call. But we did want to just point out, to you guys here how we go about finding the right plan for you. And the best thing about, I think, what we do with our clients is, we value the personal relationships that we develop. And once you are a client of ours, we do an annual plan review because in September of each year, after you've been on Medicare, you're going to get an annual notice of change from your insurance company. And that's going to talk about what's going to be different for the following year than the current year. So there may be changes to your plan. So you have to pay attention to that letter. Even have sometimes the plan won't even be offered the next year in some cases. So very important to pay attention to that. If you haven't read your annual notice of change letter by now, here in October, I suggest calling your insurance company and getting a copy of it so you can see. And of course, you can always give us a call, and we're more than happy to do that for you, take you on as a client, 609 496 8030 to contact us. But what we do for our clients, once you're with us, we get that information actually ahead of time. We can't divulge it until October 1st, but we're going to be on it. You can always reach out to us when you get it and see, hey, looks like my copays went up, or some things changed here that I'm not really liking. Is there anything else out there? And we'll shop and we'll get you the best possible deal for the upcoming year. Because things can change. Insurance companies and doctor groups can change contracts. Medication drug lists can change. Maybe your healthcare needs changed and you need a different type of coverage. Your budget in this hyperinflation age. Maybe you're looking for a Part B premium reduction if you can get one. There's many factors at play. So um, we just wanted to walk you through that process. Again, if you have any questions, you want to reach out to us, 609 496 8030. You can also check us out on Facebook and visit us on the web, www.jwseniorinsurance.com. And thank you guys again for tuning in, and we'll see you on the next one. Take care.